Sometimes when you hurt yourself and it's too serious to go to a GP or doctor about, you might need to go along to your local hospital to get checked out. Depending on where you are in the country, you might need to go to different hospitals. If you're injured, you need to make sure the hospital you go to has a casualty department. We're going to Our Lady's Hospital in Cashel, County Tipperary. When you arrive at the hospital, you'll usually see a big sign that tells you how to get to the different hospital departments. Even though it might seem like the obvious choice, you don't go to admissions. This is for patients who have an appointment for a pre-arranged stay at the hospital. Since you are looking for the casualty department, you should scan the sign for the word casualty. That way you'll find it a lot quicker than reading every word on the sign. Sometimes the casualty department is called A&E, or Accident and Emergency, so look out for these too. Hospitals make it as easy as they can to find your way to the right place. But if you've hurt yourself and are in a bit of a panic, it can be difficult to work out sometimes. So don't be afraid to ask for directions if you get lost.
Excuse me, could you build 10 wood emergency rooms, please? I'm after having an accident.
Yeah, straight through those.
Thank you very much.
Hospitals are broken up into lots of different departments. X-ray, physiotherapy, radiology and theatre, for example. But what you're looking for if you've had an accident is casualty.
Excuse me, I'm after having an accident. Could you tell me where to go, please?
How are you doing there? If you check in at the casualty, stay beside me, they'll look after you.
All right, thank you very much.
When you get to the casualty department, you need to register with the clerical staff.
Excuse me, I'm after having an accident.
They'll take your details, such as name, address, and the name of your family doctor.
1984.
There is a charge of €60 for admission. You can pay this on the spot, or if you don't have the money on you, you can get a bill that you can pay later. However, if you have a medical card, there is no charge, but you do need to have it with you.
Now, have you got a medical card?
Yeah.
Can I just take the number off you, please?
Yeah, just a second.
You might have to fill out a form before the staff in the emergency department look at you. This form will ask you details about your condition. You needn't worry, everything you put on the form is private, and the hospital won't tell anyone else about it. The next step is when a nurse will examine you to work out how serious your case is.
Well, when they check in at reception, the nurse in charge of triage gets the chart, goes out and calls the patient. When the patient comes in, we generally speak and ask them to sit down, ask them what the problem is, and they need to tell us whether they're allergic to anything, whether they've ever been here before, whether they've any other injuries other than what's apparent. What did you cut it with?
I was cutting vegetables and I cut it with a knife.
Right, okay. In terms of, not an injury like this, but in terms of abdominal pain or something that's not obvious when a patient comes in, they need to be able to tell us exactly what's going on in their system, even if it appears to be embarrassing to them. Patient confidentiality is number one in an A&E department, so the patient needs to tell the nurse exactly what's going on.
Once the nurse has had a look at you, they will be able to tell you what your treatment will be.
We treat the injury and explain to the patient how long they're going to be. Now, if it's a minor injury, like this is a minor injury, we dress it up, get them to wait outside, and then they're recalled again, and the second time they're actually seen by the doctor.
It's a good idea to keep track of how long you've been waiting in case someone asks you. Try to remember what time it was when you first talked to the nurse.
Linda McCarthy, please. No, Linda, come in now this way, please.
So Linda, your wound was quite superficial.
When the doctor gets to you, he'll ask you questions and give you treatment. He'll also talk to you about your condition and what you need to do about it. Sometimes medical terminology can be difficult for ordinary people to understand, so you need to make sure that you understand what the doctor tells you. If you're confused, ask him questions.
Keep your arm elevated. Okay?
What does elevated mean?
What elevated means is you'll need to keep your arm up on 2 pillows at home when you're asleep. Okay, just keep it raised.
So you want me to keep the wound clean and
That's right.
get 2 pillows at night time and leave my hand rest on it?
That's right. And during the day, do wear the sling
Wear the
itself.
sling.
Yeah. Keep your wound clean and keep dressing it. Okay, and if you have any worries, you're very welcome to come back.
Okay, thank you.
After you've received treatment, if you're lucky, you'll be sent home. Nobody likes going to hospital, but remember, they want to help you and send you home in good shape.